Texas, basically from Sugarland, Texas. One of my passions since childhood is knowledge sharing. Uh, as part of that hobby or that passion, I organized over 250 plus webinars and seminars in last 2 plus years related to all different fields. It can be immigration, taxation, medical, investment strategies, business opportunities, new technologies in IT related to meditation, each and every different field, wherever I think that there is a value for our community, for our members, I try to bring those subject matter experts where they can share their experience, their knowledge with all our group members. We had right a minimum average 400 to 500 participants in each of the sessions. And also, especially in this COVID situation, what I thought is like instead of panicking about something which is outside our control, I thought we can use this time to invest in ourselves, learn some new concepts, new things which are helpful for each and every family. As part of that, we did over 40 plus webinars in last 12 weeks. And next webinar on next Friday on Forex trading. I'm talking to Rob Booker. We already did once around 1 year, 1.5 year back. I am planning to do one more on next Friday. And if you want any other subject matter experts, if you're looking for any other information which will be useful for a larger community, you can message me or you can email me. You can email me on kishore.ramaraju@gmail.com, or you can message me on my phone number 832-867-8808. And these are some of the topics we had on related to kids and college education, related to investments and career, related to immigration, real estate, related to mindfulness. We had each and every different various sessions related to all the fields. If any of you would like to watch them, you can go to YouTube, search on my name, and then you can watch the videos of the previous sessions. And now time to introduce our guest speakers. It's my pleasure to introduce Dr. Surya Raguthu Garu and Manjula Raguthu Garu, one of the best couples I know in this country, and they're great community leaders. They supported hundreds or maybe thousands of families in Houston, especially old parents, right, who came during COVID situation or even before that. Whenever there is some issue, they are always there to help our community. So both Surya Garu, Manjula Garu, they are residents of Sugarland, Texas. Surya Garu, MD, is a physical medicine and rehabilitation specialist in Sugarland, Texas, and has been practicing over 20 plus years. And Manjula Raguthu Garu, family physician and primary care doctor from Medwin Family Medicine and Rehab, which was formed in 2004. She serves all age groups, including kids and up to 100 plus. And as I already mentioned, both of them are great community leaders. They support each and every non-profit organization, and they did a lot of campaigns for a lot of our group members, where they did all the free medical tests, including blood tests and all different things. So supported over thousands and thousands of members. So thank you, Surya Garu, Manjula Garu, for all you do for our community. You are a wonderful asset for our community, and thanks for taking time on a Friday evening to share your knowledge, your experience to the next generation on how they should prepare from now if they are looking to pursue a career in medicine. And before that, especially because of the COVID situation, I request you to start with like what are the precautions? It can be kids or adults. How we should, what precautions we should take in this COVID situation. Again, the number of cases are increasing in all the states. So please start with that, and then we can go to the actual topic of how kids should start planning from their childhood on how to pursue their dream uh, of becoming a doctor or getting into the medicine field. It's all yours, Surya Garu and Manjula Garu.
Thank you so much, Kishore, and thank you for the nice introduction. So let me share my screen. I have a little PowerPoint. We'll talk about the COVID and how we are able to survive the storm.
First of all, Kishore, I thank you on behalf of all the Indians and the kind of hard work you have done and the kind of sacrifices and the family time you put forward in putting up these seminars and webinars, and bringing up a huge group in terms of bringing up all the Indian forum together. Your leadership is amazing, and you have been very, very kind, and you're blessed with your wife and kids are very supportive, and you've got amazing friends in terms of putting this together at various forums and locations. And the words are not enough, the kind of dedication and sacrifices you have done for the community. And on behalf of everybody, I really, really thank you from bottom of my heart. And this community badly needs leaders like you. There are not too many people who I can compare with, in spite of so many events. Is that the count is endless in terms of putting together and helping in each and every need and each and every aspect of the community needed. You have been always there for us. So I really thank on behalf of us and on behalf of all the Indian community for putting forwards and bringing this. So your leadership goes a long way, and your help goes to a lot of families and the kids also. Thank you for that.
Thank you, Surya Garu, for all your good words.
In the present situation in the COVID, everybody knows what COVID is by now. It's a pandemic caused by an RNA virus, and it's really causing serious illness to the people. I think worldwide there have been a lot of deaths, more than 250,000. And the statistics are exorbitant, like to look at it. And the virus is similar to the SARS virus, and it's spread by respiratory droplet. So why are we even stopping going out? Why are we limited to staying at home? Why are we quarantining? Because it's spread by the respiratory virus with the close contact, and this is causing serious illness. 2% of the people that are affected end up in the ICUs and can die. 60 to 70% will survive, and there's about 10 to 12% which can be asymptomatic. That means you don't even know that they have the infection, and they can still spread the infection. So within the US alone, there have been more than 3 million people affected with the virus. And we do not have capacity to handle more sick people at this time, because most of the hospitals have been full. Okay, this is about a month ago. And 2 days ago, we had 7,000 deaths in one day, which is a lot. Okay, and with so much uncertainty, we all know now, half the schools have been quarantining, the colleges are shut down, the schools are planning on online education for the next semester. And are we even prepared for that? At this point, it's very difficult for the parents, for the teachers, particularly with two parents who are working, to try to pay attention to a child when they're doing online classes, because some of the schools require that they have a parent with them when they're doing the classes. So that kind of puts a stress and a burden on the parents' time. Added to that, it's very unfortunate for the graduating class of this year, they missed a lot, because many of the colleges at this time had to make accommodations on the SAT score or the ACT score. And whoever were planning to do it at the 11th hour to prepare and get a better score in the SAT, they didn't have the opportunity to do that, because they had to be looking, or they were assessed based on the 4-year grade point averages, which sometimes many kids may not be putting the effort starting from the beginning. So I think at this time, we need to all look into all of that. At this time, let me say a few words how we can at least prevent ourselves from getting sick from the virus. So the best thing you can do is to prevent getting sick. Because the statistics of you getting sick and surviving, it's very variable right now. And people who have other comorbid conditions like diabetes, hypertension, who are very obese are ending up in the ICUs. People who are smokers who are ending up in the ICUs. And the people who end up in the ICUs, 60% of them are not surviving, which is a very huge statistics. Still, in spite of the newer medication that just got released or FDA approved recently, the remdesivir, people getting the plasma transfusion, still we are seeing a lot of really sick people. So the best way is wear a mask, social distancing, hand hygiene, and really take care of personal hygiene. And if you go out and come back, it's very, very imperative that you wash your hands and face and change your clothes. Though initially they had mentioned, okay, the virus survives on the cardboard boxes and all that, all those things have gone away right now because they could not prove that the virus survives more than 4 hours on any food packaging or the cardboard boxes or any kind of other material that you bring. So protective gear, always prevention is better than cure. Preferably if you get a hold of an N95 mask, you wear that and then you go out. And then these are very serious and uncertain times, and you have to take preventive measures so that you don't get sick. Even one person sick in the family puts a lot of stress on everybody else because everybody has to quarantine and you're stuck in the house for 2 weeks. And from one person to the other, if there's a 4 or a 5-member family, sometimes the third person will not get the infection for about 2 or 3 weeks. And then again, the quarantine cycle can start over. So that means sometimes you can be stuck at home anywhere from 4 to 6 weeks. So in the middle of all this, the prevention is the best thing. And planning for schooling. How do we plan for this and what are we looking at it? How do we plan the activities with the parents and the kids and the teachers? Because hopefully this year, at least for the first semester, looks like everybody probably is going to end up being online. Many colleges are opening with the social distancing precautions, though they're giving the options of taking a week off, 1 semester off or doing them online. And those are little things that everybody should be looking into and trying to plan to make accommodations and planning for that. And coming to planning a career in medicine. So we have 3 kids. One of them went into medical school. The second one was joined Stanford. The third joined Babson for business. So what I know now, I wish I had known for my first child. It was a hard situation as a first generation immigrant to know the system in this country. And because everything is so meticulously planned in this country, you have to be aware and you have to start planning. And thinking about careers, don't force your kids for anything that they are not prepared for. From childhood, try to expose them to different careers that they might find interest in. There are kids who might be interested in sports. There are kids who might be interested in robotics or computers. Kids might be interested in becoming physicians or scientists. Whatever their interest is, try to help them pursue that goal. Ultimately, that's what will help them be happy in their life than forcing them into a career that they may or may not like. Yes, being a physician or getting into medical practices, it's always rewarding if they have a passion for it. There's so many different careers even in the medical field. From being a physician, a nurse practitioner, physician assistant, exercise physiologist, sports medicine, respiratory therapist, and now there's also neuroscience specialists who specialize in the brain. and there are multiple other careers. So planning to get into a medical school is very, very competitive. And the most competition that we see is mostly from South Asian kids. So Indian kids are there, a lot of them. There's a lot of Chinese and Korean kids. I mean, there's not a whole lot of Japanese people in this country, but mostly Indian and Chinese are the people who are competing for the medical careers. And so the Indian kids are competing against their own friends. That becomes sometimes very stressful for the child. So you have to look at trying to cope with that and planning ahead and further. So starting with the summer of the 8th grade, if they plan to pursue a career in medicine, they need to look at the college and look at the curriculum requirements, what they need, and figure out if they really can plan to have all that in the 4 years of the schooling. Sometimes you cannot achieve all that because you have to plan and do classes in the summer, do some extracurricular activities, do some volunteer work, do some service projects, and just prove that you do have a passion for the service. A lot of kids are thinking, okay, you go work at a hospital or a nursing home during the summer, they think that is enough. Now, particularly for the medical fields, they are looking at a person who is passionate about caring and who is also very empathic and who has been an all-rounder. So it doesn't matter if you have a 3.4 GPA, but if you have been an all-rounder, you probably have a higher chance competing to apply for a medical school than a person who hasn't done anything but has a 4.0 GPA. And then looking at other activities, curriculum is one. The second thing would be you have to focus on doing either research or doing any kind of service or creating something differently. Okay, so I can have my Dr. Surya and my son Chetan is also here, got into Stanford. They can say a few words about how we can try to make a difference in what we do. Any questions so far?
I have a few comments to make. In spite of all the scariness about the coronavirus, even though it's a novice virus, it's a new virus and a new disease, which impacted the world in terms of pretty much everybody paid the price for it. But the good thing is, that in spite of the vast increase in cases, the outcomes have been much, much better compared to the initially. So if I had a choice whether I would get a COVID virus now or 2 or 3 months ago, there is zero doubt that I would opt to get it now. So that doesn't mean or a license that you can go out and expose yourself. I'm going to explain a few reasons why it is. Oh, by the way, my wife was also COVID, and my office was also like 5 or 6 months. So we shut off the office for 2 to 3 weeks and we reopened it. So first-handedly, we went through that. And there are stages of the infection where you need to be more careful and prepared in terms. So actually, to tell you the truth, like my wife is very active, but she was bedridden. She slept almost 3 days straight because of the body aches and other stuff. So she's here talking to you guys, but we only know the pain we underwent in terms of putting this together in terms. The reason why, if we didn't understand the disease properly, we probably would have had some very, very unwilling or bad outcome even in my family. So, I'm going to talk few things. People should understand that this is a strange virus. Even before you start developing symptoms, you are pretty much infectious. That means like even before you develop some cough or fever or anything, then you are then you can be infected 2 or 3 days before. So that's one thing. So the symptoms you need to be careful are cough, fever, temperature, extremely severe body aches in terms of, and some of the cases they're present with the GI symptoms. That means like they have massive diarrhea, and some of the cases present only with GI symptoms. And not to mention that there are so many asymptomatic patients, you know, like who are going around. They don't manifest anything. For example, I was tested negative, but I lived with my wife 24/7, and 4 or 5 of my employees got super sick. So pretty much we were working through, except this. So a lot of people, even in the family, some of them they develop it and some of them they don't. It doesn't mean that who develops it or anything, but there are some few things we can do in terms of prevention, and we're going to talk about that. I'm going to do. So the next question is the testing about COVID. The COVID is a very, very strange disease. A lot of people have false positives and false negatives. And there are 2 types of testing. You know, there are many different kits. Initially, we wanted to do a free service, so I bought in about 500 kits. And we kind of realized that those kits were not effectively screening them. So we took a loss on that and we stopped testing because there were a lot of false negatives initially, those IgG antibodies. And so the initial one, what is called like a nasal swab test, is a PCR test. Swab test is probably more accurate, in spite of that 15 to 20% of them are they come out negative. So the antibodies testing is notoriously bad in terms of whether you develop antibodies or not. Not to mention, the thing is that, so those tests are not very reliable, but even the PCR testing depends upon the stage of the disease you develop. So one of the key things is, as soon as you develop symptoms like, you know, body aches, fever, cough, or any major GI symptoms, we advise you to get tested right then and there. But after a certain period of time, they may not be positive. So some people, you know, initially they're positive, they're negative. So to make the story short, instead of confusing you, the most important thing is in terms of, you know, wearing an N95 mask, and a lot of the places and the stores, they are selling it for very, very affordable price. So we made sure that, you know, we have like 25 employees and all of them wear N95s, and we do, of course, social distancing. We keep our patients outside when they call in, and we take them, or when they come in, and in bunches, we separate them into, separate them with like 6 feet apart and that kind of things. The thing is that the misnomer about, you know, the vegetables and all those things carrying, you know, infections are, that has changed a lot in terms. So if you just warm it, you know, your food or anything, put in microwave, in 2 seconds, everything gets died. So if nobody in the house is sick, you don't need to go out of way to keep on cleaning the house and everything. That's not going to, if nobody in the house has COVID or any symptoms or anything, you really don't need to go out of way to keep on obsessively clean the house and that kind of stuff. So that's about testing. The most important thing what anybody should monitor is like the way they are breathing. If you have any symptoms of breathing or a little bit of shortness of breath, that's when you really want to get aggressive in terms of monitoring, because the people who go to the hospitals initially are showing to get much better outcomes. So the thing is that you need to monitor. There is something called pulse oximetry. It's not a very big It's a small gadget. You can hook it up to the finger and you monitor your oxygen saturation. Anything less than 95, you get much more aggressively. And, like if you run into too much fever or extremely body aches, the body aches and the pains are like, it's beyond imagination. That's so aggressive. So, yeah, people say don't take any non-steroidals. But those are fine. You can take Tylenol or anything. And when you try to keep isolated within the house and wear a mask, and everybody wear the mask. Those are the things which can help you not only, get it, but you're also, so the thing is that one of the worst things which is happening is that people used to go into heavy crowded places like bars and nightclubs. That's where a lot of things. And the thing is that there are some, Americans are so stupid in terms of doing all this mass rallies and other stuff. I don't mind doing for a reason, but I should be stupid enough to go out and do these kind of rallies or go to bars or nightclubs and expose yourself to this, because you're not only at the risk for yourself, but you're the risk for others also. The other thing is, that you kind of need to know when to go to the hospital or an emergency. Forget about the financial issues, that who's going to pay the bills, how are the insurances covered or not. If I'm not mistaken, correct me, all the COVID admissions are covered by state, right?
No, they have. I mean, the pandemic, some of them are covered by the federal funds.
So for the money part doesn't need to hold you off in terms of going to the hospital. So the reason why you want to go to the hospital, and unlike most of the people, everybody scares you. There are about 85 to 90% of the hospital admissions are discharged from outside. What does that mean? The thing is that when you go to the hospital, they do some basic testing. One of the testing, there are a few tests I'm going to tell you what they do in terms of knowing how severe is your case, or whether you really need to be admitted or discharged and managed on an outpatient basis. So the things where they look for is like very, very simple test, like it's called D-dimer. A D-dimer is a marker for inflammation, and in terms of if you're more prone for any pulmonary complications and clots and DIC, that kind of stuff. If that marker is certainly elevated, then they really admit you into the hospital and monitor. That's one. Two, they're also going to check your bleeding and clotting profiles, which is a very, very simple test. If those things are normal, then they will send you back. The other test they do is if you have very minimal symptoms or anything, they do some CAT scan of the chest. If the CAT scan of the chest, if you have any infiltrates or any of the issues, that dictates in terms of knowing the severity, whether you're going to progress further and become more severe and diseased person. So those are things. The other most important thing, which is a revolutionary in terms of treatment of the COVID, compared to the initial first weeks. The initially 1 to 2 months, the whole world didn't know anything how to treat COVID. What does that mean? The thing is that they have come up with a consensus that the thing is that steroids are contraindicated in treatment of the COVID. So compared to, there are a few studies which started in, I think, Great Britain, they started testing, super sequence with using very, very simple medication like dexamethasone, which is supposed to be so cheap and so easy and so easily available. So what the thing is that when you go there, and if you have any of these small, simple symptoms are there, they're going to load you up with a heavy dose of steroids, and then give you some oral steroids to continue and monitor as an outpatient. So that will change your outcome much, much better. So what does that mean? It's okay to go to the hospital and get these basic tests done to know where you are and how sick you are and where are you going? Are you one of those patients who's going to, become more sick and need ventilators? And I hate to disagree with my wife, because the capacities of the hospitals have been increasing, and they are increased more. The downtown hospitals are much, much better and equipped in terms of this thing. So it's not that bad as initially they thought or anything. The huge capacities, because I was listening to some of the consensus, like the leaders and ICU directors, they've been talking. So it's much better. The reason why I'm opting to get infected now rather than before is the outcome of steroids. And the thing is that there were a lot of people have some questions about how are you going to be using Zithromax. Zithromax and hydrochloroquine were the two drugs which were masters. So nowadays, I don't think anybody is even using hydrochloroquine, but a huge tapering dose of steroids, and if possible, sometimes they use Zithromax. And of course, the CAT scans and CRPs are the ones which need to. And remdesivir is an antiviral. I think they are using for more sicker and inpatient admitted patients. But another common mistake a lot of people don't know or anything. Please pay attention to this. This is absolutely, absolutely important in terms of COVID. There are some studies which have done. If people who are deficient in vitamin D are supposed to be more prone, but I don't know what it is. But the question is, all my family, my kids, my employees, everybody gets huge, because 99% of the people are vitamin D deficient. So this is such a simple thing. When you go to the Walmart, you go out and you get like 5,000 units each capsule. So first 3 or 4 days, take 50,000 units, like 10 capsules, 3 or 4 days together. Then you give it to the. So the thing is that there are a lot of studies which have been read in terms of immune modulation and vitamin D deficiency and vitamin C deficiency. So the other thing what you really need to do is, like, in terms of try to load up vitamin C, especially the ester C is the one which probably much better. The other supplements you need to do is you really need to add on one of the trace elements. You can do selenium, zinc, and magnesium. All the things I am saying are available over the counter. So the thing is that once you load up all this, apart from taking some B complex and our regular multivitamins, so vitamin D, selenium, vitamin C, zinc, and magnesium. These are all the supplements. Everybody everybody should take it, and everybody should load them up. And what else? Try to take the advice ASAP. And if anybody can afford to have, there's a small device, it's called incentive spirometry. That is for the breathing exercises to inflate and deflate. The other most important thing, what people have noticed, is that if you are sleeping on the backside prone, the lungs, the fluids in the lungs, they get accumulated on the posterior aspects. So one of the key things what they've kind of realized is the patients have been are put or sleeping on the face down position. That way they don't get huge accumulation of fluids in the lungs, and if you're borderline cases, so that will prevent it from progressing and accelerating. Kishore, we have enough time now, right? Kishore, are you there?
Yeah, so they got it.
Yeah, we have enough time. No, I just don't want to keep on.
Yeah.
So the simple, we are already 40%.
Yeah. So, yeah, if possible, Surya Garu will focus more on the medical profession.
Okay.
Yeah, definitely all this information is very
Because
much useful. Yeah.
but anyway, those are some of the tips I want to give, and we'll take the questions after this thing. And going back to how to apply for and prepare for the school, I have my son Chetan Raguthu, and he can say a few words how to prepare for the school.
Planning for the college. Yeah.
Preparing for the school and all.
Preparedness? Yeah.
Okay.
Just
I would say the best thing right now for students in middle school that are transitioning to high school would be to make sure that they're set up for classes that might be difficult because it might be easier to take them at home, especially because it's online now instead of in person, where there's a lot of distractions, you know, there's kids playing around, fighting all the time, stuff like that. So if you can take AP classes, I'm not saying most students will be able to, but especially in the 9th grade, that would be a good place to start because it'll make them more equipped to continue that path. And then that'll show up well on their transcripts, especially when they're applying to college. And if they are applying now or in the next year, then even if they don't have SAT scores, their GPA is also very important because that's one of the main factors aside from extracurriculars that people are looking at right now. So do you guys have any questions?
SAT, ACT preparation of it. How soon they can start preparing for ACT and SAT?
So for the ACT and the SAT, it would be best to start in 9th grade because it's a test that you can gain once you know what they're asking for. For me, I started in 10th grade, but by the time I got to 12th grade, I was scoring perfectly. So it made it a lot easier just constantly taking it and getting better at it. So
Yeah. Thanks, Chetan. Welcome again. So there are a few questions, Chetan. First question. This may seem like a dumb question, but it is something that has been on my mind. A lot of people tell me that becoming a doctor or anything in the medical profession is mainly for people who are naturally smart. I am not like that. I have to usually work 3 times harder than other people when I want to do well in something. My mom always tells me hard work beats talent. What do you guys think?
We totally agree with the mom.
So I guess for any field, especially medicine, even if you're not smart, it's a lot more work than it is just having knowledge because you're studying almost, like 4 or 5 hours every day, even if you're not even in the medical field, but you're going for it in your college and, just in that process to getting towards it, you're going to have to put in the work. Just because you're smart won't necessarily make it easy for you to get into the field. You still have to put in the work, but putting in the work will pay off in that, you will gradually grow your mind to become more accustomed to learning, and that will eventually help you get smarter.
As a parent, I say a few words. The thing is that if they start preparing very, very early, he says 9th, but I would consider probably 7th and 8th one. And 2, in case if you can try to get some one-on-one coaching or anything, not that it may help you, but they need to understand exam taking skills. So the thing is that in case if they can take some mock testing or go to one of these testing centers, and the earlier you prepare, much better. The reason you want to start early is not because you're behind or not because you're smart, but you really, as a parent, the parents need to understand and the kids need to understand what does it take to prepare to get where you need to go. That's 1. And 2, on the simultaneously, they need to be also be focused on doing some extracurricular activities. That could be anything, and preferably if you can come up and print some articles, 1 or 2 articles, or some literature papers or anything, you are looked at much differently. So otherwise, like what we did for the Chetan and Neil is the thing is that Chetan has organized a huge eye donation camp in terms probably. We have thousands of the people in terms, and in India, it's only takes like $30 to get a cataract surgery. So for the Neil, we organize many healthcare camps in terms of free healthcare camps. You really don't need to do and spend that kind of time. As a parents, you have to take them, get involved, and have some paper of recognition, like multiple, like, few of things, and whatever you do, try to get some amount of documentation and preparation and put it in the part of your package in terms of presenting when you go for it. What does that mean? I mean that the thing is that equally important taking, preparation. Earlier preparation is important, but at the end of the day, preparing the whole packet in terms of presenting is extremely important. That means, like, if you are doing, elective volunteership, or you're working in a, Red Cross, you're working anywhere else, all those things are equally important. It's basically like preparing for your CV. Most of you are computer guys. So presenting and packaging is equally important in terms of writing resumes, letters, and all those things. Oh, by the way, we helped a lot of people in terms of doing some one-on-one public speaking courses, and we used to have a friend who used to teach hundreds of them. We have an excellent what is that Mondragon used to do? What is that called?
Counseling.
Okay,
So
counselor.
counseling.
He's one of the best counselor. He probably rated as #1 counselor in the Texas state in terms of preparing and putting things together. And we used to pay him on one-on-one basis to come and spend tons and tons of time with our kids. So find one counselor. If anybody is willing, they can get in touch with Kishore Garu, and I'll happy to share the numbers of Mondragon. He's amazing in terms of, so what I mean to say is the thing is that talk to somebody who can, and start early, like talk to somebody very early, and the amount of personal dedication and the time the school counselor gives is not enough at all. As a parent, as a kid, like it really doesn't work out. In my opinion, you spend that little money and buy that counseling service, so that, and buy them very early in terms of, he practically helped us in terms of my kids in planning from 8, 9, 10. Hey, this class makes it hard, this class makes it easy, this class is better, this class is not better, this one is more easy for you to get your GPS scores higher. Like, you're good at math, so we're going to focus on math and take only easy classes. There's some psychology classes and language classes. So all these things, intuitively, the thing is that I thank my wife more than me. She was more involved in that in terms of doing this. But we in turn hired Mondragon for many students, like so many kids in the community. So for the parents, you really get involved, and we cannot pat the brain, or we cannot put our kids down, because you need to understand how this system is different than Indian system in terms of preparing and packaging and presentation, and start early, start getting counseling, and if possible, hire a private counselor. I can't emphasize more than enough, and earlier the better.
Thank you, Surya Garu. That's a great session.
Kishore, can I ask one question which is related to what you just talked?
Sure, Ram Garu. Yeah.
Thanks, Andy, for this session. One quick question I do have is, you said it's good to document all the service activities that they have done and kind of weave the thread which passes through all of those service activities. See, there is stuff like a Presidential Service Award and such My kids have done immense service activity rolling into hundreds of hours. But apart from putting that on a resume and potentially getting it from the organization where they have done it, which may or may not be recognized by the school, is there any known organization that takes all those service hours and gives a certificate which is more acknowledged and understood by the UT Austin or some of the good schools in the country?
Okay, I will comment on that, Ramgaru. So, you are in Houston?
Yes, I'm in Houston.
Okay, so if you are in Houston, okay, I will tell you, look at Seva Houston.
Yep.
I don't think there's any organization that will put them all together and give the credit. The only way you can do that is you have to know your school counselors one-on-one to have them get it all onto their resumes and give them the credits. But the best thing, if you're volunteering or the kid is volunteering in different entities, and if you find, okay, I'll tell you the one thing you need to get is a recommendation letter from a person other than the school person. Okay, you get a school teacher, a counselor, and the third person is suggested to be a person that you know other than from the school. And if he has volunteered and has gotten a very good rapport with the person that and has done something differently than the other kids, and that person can give a good recommendation, that will add a lot of value. Okay, and the Seva USA, I'll tell you a couple of things. Seva USA, all you need to do is 100 hours over 2 years or so, and you will get a presidential recognition. And there's also leadership programs within the Houston area. There's one is the YLDP, YLDPHouston.org is the website. It's a youth leadership program for kids of Indian origin. Usually from the 11th and 12th grades is when we take it because I'm on the board. So that really helps to add value. They teach a lot about leadership. They're exposed to leadership. They do have different activities that will make them be involved in service as well as leadership. And at the end of it, you get a certificate. There was another one called Lead Houston. That one also, it's in the summer activity. I don't know how this years will go on for this year and the next year. But with the Seva, I know they have been doing a lot of service in spite of this with the COVID, where they have been volunteering, serving food or packages, whatever. Kids have been helping, parents have been helping with the PPE precautions. There's something that you might want to look into now that the kids are at home, they have some time to spend. I know I hear a lot of kids being socially isolated, struggling to keep up with their friends or getting really depressed, staying at home. But that might be something even once a week, you go and volunteer a couple of hours, it adds to the resume. Because with the Seva USA, it's only 100 hours that you need. Okay, and there are different things. You can also, there's another center here in Houston, I don't remember the name, where they teach for the blind people. You can even go and volunteer there.
So,
Got it. Thank you. Manjula garu, the last one you said is League Houston?
LEAD.
I'm sorry, Lead. LEAD. Okay, got it.
Yeah, Lead Houston.
and one more thing. My kids used to go to Harmony Science Academy. So we had a relationship with them in terms because I helped them to get a major funding from the state, doing some advanced, especially for the pre-medicine program. So we got approved for Harmony Science because we had about like 35 to 40 students rotate with us on a time-to-time basis. Most of them were my kids. That time we were more active when these kids were in the school. By the way, we have a very, very good resume in terms of our own self. Like having started run a hospital. So if they rotate with me, I'm going to put a good recommendation later. So like try to cover those things. It doesn't have to be like 10 weeks or anything, even though they rotate like 3-4 days, 1 week, I kind of help them to write up a very good recommendation letter. So those help, and try to use some of these bigger names when they reflect in the society, like Red Crosses, ERs, and it's like, maybe some, maybe like you volunteer in the city council. And I always ask them to write 1 or 2 articles and any online magazine. So basically what I'm trying to do is like you help them to write even the smallest of the smallest, and if there is some kind of reference on internet, you can post it as a link to that, saying that, hey, my son is an author of this article at this. Anything can be posted. Even it doesn't have to be great, but you can even create a great, YouTube video or anything on certain thing, or so whatever you can do to help others, or try to get some, home for age, or so those, like hospitals, nursing homes. It doesn't have to be, like you don't spend years and years on them. So yeah, try to come and spend some time in case if they're in Houston. We'll be happy to help them, and probably once they see. What I do is that whenever they rotate with me, I ask them to get a pen and paper and write all the activities day to day, and put those things, hey, I've done this, I've done this, because they're doing it, but they're not capturing everything. So is the parents. And one more thing, the last but not least, every school has a program to continue their resume and education or personal statements during their career, right? So you need to be aware that you can prepare your resume and everything while you're in school, right?
Yeah. The best thing is to do it while you are doing the activities so that you don't miss anything. So as I went through school, starting from the 9th grade, I created a list of everything that I've done, and then slowly started adding more and more and more to it. And then at the end, right before you're applying to colleges, you can take out the stuff that probably doesn't seem as significant and make sure that you have only the best things and best qualities shown on that resume, as well as your applications.
So give yourself time, prepare well, use all the amenities and the resume preparation, everything each school has. And one more thing, please, as a parent, go and spend time, because I did not do so. My wife did a lot for the kids than me in terms of, we are always busy or whatever. You can find million reasons not to go, but once the time is passed, it's passed. So take yourself time and use all the, try to talk to your counselors, talk to the counselor instead of you trying to reinvent the wheel. Try to talk to the counselor and meet them as many times as possible. That is so, so important. And start preparing early and keep on adding every small thing they do, add it. Eventually what my son says is it may not be relevant or relevant, but if it is there, then it, who knows, like something, like some rare thing, like for example, like some of the rarest thing we will think is not important. Sometimes, basically you're trying to project your kid as well-versed, holistic, overall, apart from scores and GPAs, and so you give a bigger and better and a complete. Hey, you know what? If my kid goes out, he can change. Basically, they're looking to change their life and change others' life. And that how we're going to portray it on paper, that's what is more important in terms of putting things together. This will come only while doing and getting involved. It's a process. So please don't discourage kids that they have it or they don't. You really need to get involved and involve early in terms of getting, and maybe read some articles. Or we used to have a lot of private shooters, and wherever is need is there, I used to private pay them in terms of years together. We used to have like, a public speaking guy who recently died, but he had hundreds of kids. I introduced them. So, or maybe, for example, spelling bee and all those extracurricular activities, chess and whatever. Add on, keep on adding. And it's like you prepare your resume. The same thing for them in terms of putting things together. I hope I answered some of the questions. If not,
Yeah.
Thank you so much.
Yeah, thank you, Surya Garu. Next question, Manjula Garu. Are kids allowed to volunteer at the hospitals during this time?
No, not at this time. They're taking a few kids, but most of the hospitals, the infectivity of the COVID and the safety of the kids, they're not taking them right now.
Okay. My son is now in 3rd year in undergrad in pre-med program. Any tips at this stage for my son?
let him come and look at it. We don't want him to be academically successful. We really want him to be financially and academically successful. ఒక్కసారి మీరు పంపండి మా దగ్గరికి, ఒక 2 రోజులైనా పంపండి, నేను ట్రైన్ చేస్తా.
Okay, and one more thing, we have a couple of questions about outside the counselors and the kids. The first thing is, whatever path they want to go, whether it's business, somebody wants to go to business at Harvard or Yale, or somebody wants to go to medicine at NYU or Cornell, please start looking at the course requirements, because very often than not, it happens that at the end of the 11th grade, you realize you don't have all the course requirements to apply for those colleges. We had a lot of kids that came to us to get advice on that. So try to plan early. If they think they want to go, okay, they have a dream college that they want to plan to go, look at the college requirements, put it on a Excel sheet. Okay, dream college number 1, second college whatever, the third college whatever, and the fourth college will be a local college. It could even be UT Houston or whichever is closer to you. That might be the easiest to get in, but at least look at the course requirement, plan for that. So between the 8th, 9th, 10th summers, I know the 11th summer is going to be really busy, taking the SAT or whatever, but between 8th and 9th and 10th, you have enough time to take online classes or summer classes. You can take easy courses, creative writing, psychology, literature, art appreciation, anything like that to boost your GPA. And some of them we had, though they had a very good GPA, we just had the kids do additional courses. So you get the additional credit in spite of the fact they had multiple AP courses. We made them take different courses just to get a perspective of changing the thought process. Though your mindset on going into medicine, you still want to open their thought process to other courses and at least have them look at that.
Another way to cheat or know, pick top 10 schools and try to prepare, start filling in their applications, and kind of each course has a description of what kind of a student they are looking. So what we need to do is you need to understand that, try to prepare their form and look at their needs and what are they trying to look and in a student. So use that when you apply for that. Use that same and try to complement that. Whatever if you do it earlier, it's much better. So basically, they are helping you to cheat. What they want. And a lot of people are like. I've seen so many people in terms of, they just fill something and related to the, not related to the school requirement. So look at the requirements and try to copy them and use them. Try to you can use them.
Okay, somebody posted about a BSMD, Chitra. It's good only if the kid is ready to cope with it, because it is a lot more stressful. And the combined programs, which they are into 7 or 8 years are a lot more stressful than the regular program. But most of our kids are able to cope with it. And it's actually better you get into the program because you have a security that you're going to continue with that to the medical program, because getting them CAT, taking them CAT, and then competing again is a lot more stressful than having a committed BSMD program.
If you get, take it, Andy, and especially if it is free and paid or something.
If anyone has any other questions, you can unmute and you can ask them.
I have one more question, Andy. So my son, like many teenagers, he is trying to figure out what he's planning to do. Our focus so far has been in the medical field. He has done research as well. But in case he, let's say, if he decides to go into engineering, we're already in 11th grade summer, between 11th and 12th, he's deciding. Is there, if he plans to go into engineering, can he weave the medical research he has into something which would also aid his endeavors to become an engineer? Is that, or getting into an engineering school?
Absolutely, because medicine doesn't exist without engineering these days. You know, one of the biggest things is MITs and other stuff. There is a huge thing about biomedical engineering is key. Robotic surgery is, you name, artificial intelligence, and nowadays there has to be some form of integration between medicine and engineering, also the management and medicine. So anything we do, you please take full advantage of it and prepare it nicely. And when somebody, if Rook said, they say, wow, it is so different, so I want this kid. You know what I'm saying?
Okay, so we can weave fundamental medical research towards engineering as well.
Yes,
absolutely, because the future is going to be the AI involvement in medicine.
Anything, you can try to relate it, that research. Yes, you have to.
Okay, and one more question on the top is, putting on the resume, he has won this competition, that competition,
Yes.
type. That is a good thing. What are the key ones we need to keep in mind? I got 2 kids, but in terms of competition, competitive events that are recognized by the schools, what are some of the ones to keep in mind?
Okay, competition, the best thing you need to look at is getting into whichever competition you're looking at, a district, zonal, or a state level. And if you go to the national or international,
Maybe
that will be good.
answer.
Chetan can answer, and maybe, yeah.
No, so it also depends on whatever extracurriculars they have. So especially if they're going into the medical program, there's a bunch of different associations that regularly compete. Now, I'm not sure if they'll still be hosting it this year, but some of the programs will still have online competitions that you can probably apply for or get into now.
Okay. Any Chetan, any titles or anything that we should be looking at online?
Is this for college or for high school?
High school. He's in high school trying to get into college.
He needs to start a club.
Yeah, so he can start a club, but it just depends on what programs they have right now. But for the medical field, there's HOSA. I don't know exactly what levels they have, but I know most of them go all the way up to the national level. So he could try to get into that, depending on what his grade is. If he's in 11th already, then it's probably better to just focus on what he's already doing. But if he's earlier, like 9th, 10th grade, then he could get into that this year if they still have it, whether it's like online or however it is now.
Got it. Thank you.
Get a good score, sir.
I have a question. if I want to start a medical club here in my community, and there are like, say, 20, 30 students who are interested, I mean, children, I'm not talking about students, I'm talking about children who are interested to go into medical. And is there any hospital or clinics that they just come to teach children the basics of medical just to get their involvement in medical? Is there any clinics or physicians they do that?
They can rotate in our clinic because, and we'll be happy to. But the other thing, what you want to do is, you also want to get one or two counselors who are really good in terms of coming and teaching how to put all these things together. Because just doing is not important in terms of, and also presenting and preparing, and it's a little complex process in terms of the thing is, one of the key things is like, which piece of the puzzle goes where in terms of 8th, 9th, 10th, then where are your extracurricular activities, then your additional programs. So the most important thing is draw a nice clean line in terms of, then you add on all these things, how to do and where to do. And for the going with the club, yeah, sure, they are, my wife is in a group of probably 200-300 doctors. They can come anytime, and we can bring as many doctors to come and teach them or guide them.
But I'm not in Houston. I'm in Dallas, actually, in Frisco.
Very easy, sir.
There's a lot more in Dallas.
There are a lot more in Dallas. So it's so.
Okay. So is there any club? Can you suggest any clubs I can talk to?
On the Indian Association, you know what? Ask Kishore Garu to post it in one of them. Try to put what exactly you're doing, and and a lot of the doctors in Kishore Garu group will be very happy to come and give some.
Okay.
Yeah, just post it, and they'll be very happy to do it. There's so many doctors who want to do right thing, and
okay.
The kids.
Sure. Thank you.
It's not difficult at all. Where there is a will, there is a way.
Sure. Thank you. Thank you for your advice.
No.
Raghu Garu, can you suggest a counselor? You mentioned a name, I didn't catch it.
Mondragon?
Sure, I think maybe
we'll
talk to Kishore, maybe he can coordinate.
Okay, Kishore can coordinate, in case if it's not, because Kishore's hands are full. Kishore, can I give his contact number in this thing?
Yeah, sure, Surya. Yeah.
He'll be happy to do a session too.
Okay, Kishore, if you want, he can do a session for the whole group.
Yeah, definitely. Yeah, we can do that.
What is his number, please?
Yeah, I'll put it here.
Should I ask him?
Yeah, we need to ask him first.
Okay, it's his number is 979.
I'll put it.
557 9822.
Okay.
The other number probably.
No, other is disconnected.
Okay. He is fast. All my friends and teachers we always try to find the best in, and we try to go along, we tag along them. So if it is not for all these good guys who helped us, we would, probably, that helps a lot, right?
Yeah.
Yeah.
Uncle, I have 2 questions actually.
Sure.
So I'm from California and I'm gonna be a senior in high school. So you mentioned Red Cross earlier, and I've been active in my Red Cross club for 4 years, and I've been officer for 3 years. So I've been president last year and this year. And I've also been in charge of Health Honor Society and an Indian club. And I just wanted to ask you if you think that these will give me some more recognition in undergrad applications.
Absolutely, zero doubt. You will be. That is what they are looking. They are looking at somebody holistic, somebody who's aggressive, somebody is go-getter, somebody is leader. and nicely put it in nice words and make it look
Okay.
good. Collect some evidence and put some of those links on YouTube. See, a lot of times there is something called in the interview techniques when we use the residents and other stuff. What we do is when I teach the residents to put in an application, this is what I teach them. Sometimes if they don't ask you, you have to guide them where you need to go. So try to post all of things in your CV or resume or YouTube or somewhere around and post that link or something like that. You know what I'm saying?
Yeah, I started a non-profit organization this summer for, you know how there's been like a limits on masks. So around my area, I just gathered a group of friends and we all made masks and we like gave it to the nearest hospitals. So I was gonna write about that in my college applications. And then I'm also CPR certified, so I wanted to explain that too and how being CPR certified helps me realize that medical or the medicine, like medical field is what I want to be in the future.
Absolutely, absolutely, absolutely.
So maybe
But try to do all the work you have done. Try to tag on some evidence. You know, like somebody post in a Facebook
Uh-huh.
or some kind of, you know, post it on an internet or post it on YouTube or let somebody post for you or something like that. That way, when you know, if you know what, hey, this is the kind of thing I did. You know, this is my evidence. Kind of sometimes you try to give as much as this is all very important. What you said,
I see.
very very.
And also, this is like a kind of personal question, but I haven't done well on my SATs, so like I wanted to take the ACT, but then because of this coronavirus, I wasn't able to take it, so I scheduled it for September. And my GPA is good, but not very good. So if I get like a good score on the ACT, do you think that'll help me perhaps like get a little better in my applications? Because my GPA isn't as high as I wanted it to be this year.
Let me answer that question. You should be, when somebody looks at you, they should say, you know what, the scores are there, but if I'm looking at somebody as a leader or somebody who can take charge, so that's what it has to live. The bigger and the outer you're going and holistic is better. But one more thing for all the parents, I don't know, like all the kids who are born and raised here, they have a mentality, you know what, I read only 3 hours, 4 hours a day. You're killing me, mom. You're killing me, dad. You know what? I don't know. We come from a group where, you know, like we have to read 16 hours, 15. Otherwise, you have to be less than, 800 rank to get into medical school and all those. So they're here like 200 people, 200,000 people are writing. So, you know what? You really need to be patient and continuously reinforce them. It's not enough. Or you tactically take away all those gadgets or iPads, iPhones. This is a disaster. The thing is that, you know, I don't know the mentality of the kids these days. You know what? They think like, you know, if they do 4 hours work, they think that they are moving mountains. You know, like, so no, you are not moving mountains, not even close to. So you better, you get more aggressive and, you know, like, I don't know. I cannot comprehend because there's something called self-pity. And, you know, somebody saying, you know, hey, I read 8 hours, 4 hours, you know, oh, I also read 4 hours. That's not enough. So,
Also, Uncle, one last question. I obviously, since I'm from California, I was gonna apply to UCs here and a couple state schools, or good state schools. I wanted to ask, besides UT Austin, is there any other good schools I should apply to in Texas?
are you looking into medicine?
Yes, yes.
If you're going for the medical field, Bryce is also a good option. And UT Austin is also good. Are you only going for state-supported schools or private schools also?
I haven't really thought about it. My dad said that if I could apply, just apply like wherever, like don't let the chance get away. That's what so yeah, I guess.
Baylor,
I mean, even if you don't think you're gonna get in, or
UT system is very good. Baylor is good.
Is UT Dallas good?
not as good as UT Austin.
All
Baylor.
schools are good. Your choice is today. Don't limit yourself. Try to apply as many as your dad says. You never know where, you know, like this is one of those things, you know, I read 4 hours is too much now. So push it and you get more than many. You know, your dad is right, because when we come from India, we had a lot of handicaps. You guys don't have all those things, but you really need to get aggressive in terms of.
I think right now, the way things are, Texas has the most number of medical school seats. So you can probably look at all the schools in Texas. Let me tell you something. Ultimately, whether you become a doctor from Howard or a doctor from UT Austin
Come here, Chetan.
would not
1 minute.
matter. The fact that you become a doctor is what matters, unless you want to be in the academic field at Howard or Yale and be stuck in
Oh,
a
by the
research
way,
lab.
there is no big difference. Once you come to medical school, everybody is the same degree, man. Then again, this is not the end. This is only a start. Then you're going to get your fellowship, then I don't know, super fellowship, whatever, you know. So, but the question, at least you learn to be aggressive and learn to be better and better at what you're doing. So it helps you further in your life.
I see.
In medical school, there's no shortcut, you know, like it's not like, oh, I wish there is. But,
How many schools do you recommend that we apply?
As many as you can.
Yeah, but don't apply it to schools that you wouldn't accept or waste your time with. Just apply to, well, all the top schools, but also keep at least 5, you know, safety schools that you would be okay with attending. So realistically, probably 10 to 15 schools.
At least.
Okay.
Can you suggest some list of certifications? Like I just heard about CPR certification. So similar to CPR certification, is there any other certification which the kids can do?
I think for the kids, basically CPR,
ACLS, BCLS.
BLS, I think those are good enough. And they can
do more. This is like 2 or 3 days.
No, what is the other one? For the swimmers, the lifeguard certification,
Okay.
something like that. They can.
So all these certifications adds in your resume when you apply to colleges?
Yeah.
Yes.
Okay.
Got certification, BLS, and
How would you earn those certifications?
They're nominal courses, but some of them the Red Cross, the CPR, the Red Cross does for free. Some of them are $25.
Google them, you'll find time. Or else, you know, Google, if I were you, what am I? Manju, can you Google?
Yeah.
So, certificates for...
One last question I had. My in-laws are doctors in India. So if my kids during the summer holidays goes to India and gets some kind of experience over there, will that experience count when he puts it in the resume over here?
Yes, but
Yes.
I want you to do, see, if you're sending your kid to India, spend that $3,000-4,000 and hook yourself with some big name, you know, like, what is that, Eye Institute, Shankar Eye Institute, and tell them, you know what, hey, you know, they take a lot of pictures or have one of your friends or anybody write a small article about this kid came from India, you know, help give like. So the thing is that try to create leverage and value out of that and put it in this. If I were you, I would probably do like, you know, hey, you know, $30, you know, $300. I gave eyesight for 10. Write a small article. There's so many people, you know, like all these people on the internet, or you can hire one of those newspaper guys. Then you can, hey, you know what, I donated, you know, this thing to, you know, Vision to so many people, and I was featured in such a big magazine and something like that. You know what I'm saying? You're already doing it.
Okay.
So doing in your own background doesn't help. So
So maybe marketing and branding yourself into what you're doing?
Yes.
Everybody does that. That's
okay.
But how, if you don't tell them, how do they know?
Correct. Yeah. Got it.
ఒకటే కాదు చాలా అంటే ప్రతి దాంట్లో చేయాల్సి ఉంటుంది అంటే And this is the reason why you also need a one-on-one counselor apart from the school counselor one. You should start preparing the second. You need to prepare the resume from 7th, 8th, 9th, whatever. The other thing I forgot to tell, whatever. Try to research and profile each program, like top 10 programs and what they are asking in a student, and try to put them in your, you understand what I mean? It's kind of cheating, but it's not. So basically you're profiling, each program and taking few points and putting those, make sure all those points are covered in your application and paper or resume or statement. Right, Beta?
Are you still taking shadowing or interns for shadowing during this time at your hospital?
Your parents don't have a problem, we don't. But we'll make sure you have an N95 mask. If not, I'll give you one later.
Okay, but you would still accept interns, right, at the hospital?
Yeah, yes, my office. Yes, yeah.
And also, how do we find research opportunities? Like, I've been looking for many, but do we have to go through like college professors or like hospitals?
Okay, that's a good question. Most of them, where do you live?
I live in Houston, specifically Fulshire, Texas.
For sure. So are you in college?
No, I'm a sophomore.
Okay, there might be some research opportunities if you look online, but for high school students, they don't really get college opportunities. If you do know a college professor that is doing research, then you could probably ask them. But your best bet was probably to look online or trying to get into clubs that you have.
Can I talk to you? I'm a faculty at University of Houston. If they're really looking, they're serious, I will provide the research opportunity.
Awesome.
Yeah, sure, no problem.
Who is that?
My name is Krishna Boini at University of Houston. If you look at the Google it, you can find. In
I'm
pharmacy.
sorry, Krishna who?
Boini, Boini.
Thank you.
I'm a faculty at University of Houston College of Pharmacy.
Awesome.
Could you please type your name into the chat, please?
That's the gentleman. Look, guys. He's offering, golden chance, and try to do some small article research or anything and try to publish. Even if it doesn't get published, take that full leverage. It's nice to be here.
Sure.
Thank you, Krishna Garu. Very
good. Thank you.
Thank you very much, Krishna Garu. Nice of you.
No problem. Thank you.
Yeah.
Thanks.
By the way, other opportunities open through one-on-one contacts and friends and family. A lot of times, it's not a bad idea to just go to some, faculty and take Krishna Gari help also. Pick up that phone and call the secretaries. Most of the secretaries are 10th grade dropouts or anything. If they like you, they'll let you in. So the world of opportunities available. For a simple example, like one hospital has so many departments. So to complicate stuff, the COVID is one thing. So take advantage of him, and it's very nice. You can add on his name and his facilities to your resume and your research, and take a certificate. And it was the same with everybody, whether in California, Dallas, or anywhere. It's not difficult to find one. If you're really struggling one, probably you're more than welcome to call us, and we'll guide you or do research for you and find one for your part. Again, once again, thank you, Krishna Garu. That was along with the case.
No problem, sir. Thank you.
Can you please tell me your name, please? You said that you would allow for research at University of Houston. I wasn't able to hear you clearly.
Krishna Boini, K-R-I-S-H.
It's in the chat.
It's in the
I
chat.
had a question. Oh, sorry. I had a question regarding undergraduate degrees for any med school. So as long as you complete the basic requirements such as like biology, physics, chemistry, does it matter what undergraduate degree you take?
No, but that would be.
Well, it depends. You don't want to go to medical school trying to get in with the go in with the bio or chemistry, something related, even if it's not maybe it's not what you want to do. Most of the majors allow you to take other classes, so you can still explore. And I guess probably best bet would be something in the medical field. I do know people that have got in with business degrees, but most of them are very lucky, I'd say.
So what would you say are the least impacted majors in like undergrad? Because I was thinking to do biology, but then again, I don't want to do too much plant related things. I was thinking biochem. So what would you say are the most like less impacted majors that wouldn't have a lot of competition?
Do you mean for the medical field specifically?
Yes, for the medical field.
I say biomedical would probably be your best choice, but if you don't want to do that, you can go for just chemistry or any other science that you like specifically. But probably biomedical is probably the best bet.
There's a
Can you
What do
go
you think
into
about
this?
neurobiology? Oh, I'm sorry.
Go ahead.
What do you think about neurobiology or human anatomy?
That helps.
Okay, thank you.
Does going from engineering fields like electrical, computer science into medical help? See, the thing about it is that the kids are still, Dr. Raghugaru, you brought up the India makeup. I don't think I knew what I wanted to do in life till later point. So we are asking students to be passionate, know their passion and all that. I don't think, I'm sorry, but 80% probably don't know what their passion is. And I'm one of them. I used to be one of them. So
Even in the college, they don't know what they're doing, sir.
correct. So does going from
Whatever you do, excel in it.
right. Going from engineering to medical, is that a possibility? Electrical,
Yes,
computer,
possible.
medical?
But the thing is that they probably want you to be a best engineering student. Then they probably have better chances of absorbing you in the medicine, right? Whatever you do, if you're on top, then they have better chances than, if you're, then you understand what I'm saying, right? Because
I do.
The pre-medical training has nothing to do with the medicine. It's a pure humbug. And, it's a system prepared to rip off or whatever, I see, because 90%, 99% of what they're studying in, pre-med has nothing to do with the medicine. So I don't know how to say that, but I wish it is like in India that you don't, after 12th grade, you go to medical school. That means probably I should start a medical school doing that, hey, we're going to start after 12th grade. So go to the state and, we'll ask the governor or do something about it because.
Uncle, speaking of medical school in India, my dad was talking to me once.
Question 1 minute.
Okay.
1 second, beta. So,
no problem, Uncle.
Did you understand what he's saying? How to get in from engineering to medicine?
Okay. If they're already progressed to the probably junior year, then it'd be better to try and get into a minor because they might not have time to finish their coursework unless they take another year. So if they're trying to switch over to medicine, then they can pick a field like bio or chemistry and use that to boost their credit, because even if they're engineer, specifically if they're trying to get into biomedical field or something like that, the engineering degree will help when applying to medical schools.
I have a question like if our kids wants to do medicine in India.
Sir, that girl had a question, sir. One.
Oh yeah, uncle. It's basically the same thing as what the man before me was saying. My dad, he was thinking about just thinking about sending me to India for medical school, and like because I'm almost finished with 12th grade, right? So he wants to send me to India and see if I can like do medical school there, because you know how you were talking about right after 12th grade you could go straight into medical school in India. So what are your opinions on that? Because he wants me to come back again to America and still become a doctor here, but do the education in India.
Sonia, are you smart enough to get into school by yourself here?
You see, that's a very difficult question for me to answer, Uncle, because I don't know if I'm even smart enough.
I'm thinking like your dad, okay? So the reason I'm saying is, the thing is that sometimes if you can get into a combined program, it's almost same as what you go into India, except maybe a 6 months or 8 months difference, one. The other problem going to school in India, then you become foreign medical graduate, even though you're a US citizen.
Mm-hmm.
So there might be some form of discrimination because you're a foreign medical graduate.
Mm-hmm.
So this one is, if I were you, if you go to undergraduate here, if you're smart enough, you can finish all those credits in 2.5 years.
Mm-hmm.
Then I do 1 year of management, like MHS or anything. Before you go to medical school, then you are in super, super high chance of getting into very, very good Ivy League school. And this not only helps in the present situation, but especially when you go into management or some form of leadership, that will help you. That's one way of looking at it. The second way of looking at it is, not everybody finishes in 2.5, 3 years. So you can just do your routine thing. But see, I was in administration, and I was the chief resident of I used to run one of the biggest programs in the country that time. But still, going to medical school here has much more advantage if you can do it. If not, then what you learned here so far, you should really put it into the practice, and you want to be the best or the highest in your school in India. Did I answer your question?
Yeah, you did.
Clearly.
Yeah, thank you, Uncle. I don't know, my dad just has this like fantasy, like every time he's like, see, I'm not saying you shouldn't do undergrad here, I'm just saying think about India. So I don't know what to think, so I just figured to ask someone else for their opinion.
Whatever you want to do, you want to be the best at it. Let's put it that way.
Because my dad right now, he has this like assumption that because of my previous SAT scores that I won't get into any college here. But I've been trying to assure him that it's not just like GPA and scores, it's also like, how you guys were emphasizing about extracurricular certifications and all this. My dad doesn't understand that. He does not think like you. So
do you still have time to prepare for a good?
Yeah, Uncle, I'm currently preparing for the ACT. I think I'm in good shape.
Listen, just promise your dad you're going to read 16 hours a day. That's what you're looking at. I'm thinking like your dad, okay? That's okay. Okay. Who was that other, Kishore or Kumar or the other gentleman? Kumar?
Yeah.
There was another gentleman who was asking a question.
True. Yeah. About India.
Oh, okay.
My name is Indrajit. So I think should we answer the same question, like we're thinking like if my daughter doesn't get here, is it better to sending her to India and after that bring her back here? But you answer the question.
Why don't you send to Caribbean school?
Caribbean?
Yeah, instead of India. The reason why I'm saying Caribbean schools have their own network to a certain extent. Their system is pretty much taught maybe similarly like here. So that much more close to the US system in terms of training and other stuff, because all the schools pretty much have the faculty who went from here to the Caribbean. So if I had a choice, I had to send them. It's, if you're thinking that, India is far behind in culture-wise and everything, and others do have those problems. But I don't think there is no major difference between any Caribbean school or Indian school, but culture-wise and the way they behave and other stuff these days. If one of those concerns are, or the other thing is like if you can get, some kind of some medical school in India there is something called like foreign medical graduate quota, one or two seats each medical school have like 1 or 2 schools. So you need to prepare early and try to get in touch with the administration there. What are the requirements for a foreign medical graduate to go there? Sorry, foreign student to go to medical school there. That's one. And there is a difference of some amount of money you spend in Caribbean school versus Indian school. Indian school is probably going to be a lot less cheaper, but again, there are so many private Indian schools are coming up. If ever you want to go to an Indian medical school and you take as a foreign quota, I advise you to pick a good one, like one of those good ones, like Bangalore or some, or even some of the government colleges, they have 1 or 2 seats available. So I probably would get a list of all the Indian schools and try to call them during daytime and see, hey, what is the criteria for some foreign student to come to your school and what does it take?
Also, coming back to the US to practice is a lot harder.
Yeah, but they need to go to USMLE better. They need to pass the qualifying exams and other. So the bottom line is wherever they go, if they need to be top of the top, they try to be there. They're not asking for much, you know, but it's a tough. Going to medical school itself is very stressful, but everybody should need to know that you are willing to take that commitment because it takes a lot of time. You know, like not everybody, and you're going to be thousands of frustrating moments to finish before you come. That's everybody goes through this. It's a never-ending story until you really. But the good thing is that you have job security, one, and another thing, another advice I'll give for any of the students who want to become doctors, try to go into a field where there are a lot of procedures and where you can charge them not the insurance, but cash, for example, aesthetics, cosmetics, or ophthalmology. They need to look into the procedure-oriented medicine. It's a little too far ahead, but that way, you can do your own procedures and not depend upon this managed care and healthcare, so that you get a lot of money and lifestyle. So that's one thing I want.
Excuse me, doctor. I have one question. So the kids, our kids, this generation kids who are the first-gen Americans here, they really don't have a life of challenges, right? So no personal challenge to really portray in the essays. Not that the parents came in a boat here, none of that kind of stories. So how do you make your essays stand out? Especially when you're coming out of high school, where you've been sheltered by your parents, right? So
use your school counselor very well and have one more private counselor on your own. Afford that $40 an hour, or $100 an hour, $50. Take a few hours, because between you and your kid, it's not, what do I say, that the thing is that at the end of the day, you know what, oh, you're only mom or dad, right? But you want somebody else outside sitting there, talking their language and spend the time. My kids used to spend hours and hours and hours with their counselor, right? Chetan, can you answer a question to how to prepare a good resume?
So I think the best thing for kids our age and our generation would be getting exposure. So right now, I mean, most kids have a unique opportunity to take advantage of COVID and use that to boost their applications, because this is the first time that we've had anything so crazy and so stressful for most of us. And this is probably the best time for them to take advantage of, maybe like anything online that they can do, you know, like taking courses online, especially during the summer. You know, anything that would show that they're doing something instead of just being at home playing video games all day long.
Yeah. One more related question I had was, right from volunteering to any activities that we talk about, you know, you see it that it's all been done like over and over and over. It's been done multiple times by all the kids, like name it, like basically even like something like dance. Like I know pretty much most of the girls in the Houston area, they have done their arangetrams. You know, even the boys who learn violin or music, they do their arangetrams. Or volunteering seva so many times, like all kids have gone to India, they've done, I mean, so I see this batch after batch after batch. So has this become stereotypical yet with the admissions officers? Like, how do you stand out and not do the same stereotypical activities?
Yes, exactly. That's what you need to do to try to make a
Like,
difference.
Start a club,
Yeah, I think I just posted about starting.
show some leadership, or, you know, if you're doing Boy Scouts, they love Boy Scouts, but if you're a captain in a Boy Scouts, it's different. I don't know, like what are the levels are. Then you can start your own, they can start their own non-profit organization here. It doesn't have to be big. It only costs like $300. Then you can show that, you know what, I kind of taught English to, I thought that English is such a major thing. So try to do something different. And start an art, like maybe you can teach online, you know, some Caribbean schools are Mexican 10 students and how to do. So there are hundreds and hundreds of creative ways of doing it. Yes, you can do volunteer, but I wouldn't advise anybody to, I rather want to spend like a month and take a certificate and probably do something next. But not to mention, you don't forget, there are a lot of stress on themselves with all these exams and preparation, ACTs and AP classes, and so that's a lot of stress themselves. So come up with something, you know, like, you know what, you can show, you know, there are a lot of health camps go to Honduras, you know, you just go as a part of there. And a lot of people like religion part of it, like, you know, maybe religion goes a long way in terms of in this country. So put a big names like, you know, if I were you, I would go to Lakeway. Where are you in Houston?
Yes.
Okay, then why don't you go take this, you know, go to Lakeway Church and what's his name? Like, he's world famous. Then get a certificate from him.
Olstein.
Joel Olstein or something, you know, like you always try to hook up their name to the, oh, really? Are you part of the evangelical world? You know, like it doesn't matter that you're not changing your religion, but one thing, you know, when you go there, don't approach him directly. Just go to the smallest guy who's there sitting on a, you know, then, you know, don't go on a busy day. Just go on, hey, my daughter wants to, you know, can you please, if we volunteer for a month, can you give a certificate? So you're totally different now. You know what I'm saying?
Okay, got it. Got it.
So there are many, many, many different ways of skinning the cat. So,
yeah.
Yeah, you know what? I do. Why don't you organize a blood donation camp in somewhere? You know, they're all dying, but we attend this ER hours a little different. You know, in terms of presenting, you know, try to say, you know what, I did it, or he did it, my son did it, or whatever. You take, and one more thing, not least, but you really need to have somebody who can help them to write the essays.
Correct.
It doesn't matter. So they have a knack to bring all the good things up and present it properly, because I can write anything, but you know, I would never write my son's essay. He may not like it.
Yeah.
And he thinks he does better job than me, but still. So all those things.
It's not about that. The kid, whoever's writing the essay, we just need to get them to put their thought process in their essay, but you just refine it in such a way and you present it
Hire somebody.
Okay.
in a different way. you hire somebody to edit you, guide you, because.
And if you can have Mondragon, you are in a very good shape.
Okay. For Chetan and Neil, we probably did 20 or 30 times before we finally did the final submission. Okay, so we were sitting at 1, 2, 3 o'clock some days trying to edit and proofread, make sure we corrected.
So
but
question
again,
is also how you going to make shine as a, so start a club, start a, what do I say, like, you know, all these things matter, not one. So the best thing is, you know, start teaching some Mexican kids or, you know,
Okay.
or maybe, you know what, I distributed like 1,095 or something mass to homeless, you know, started write a nice article about it. Or I gave some, you know, different. So the moment you say, wow, you know, something, then that helps. There's so many ways and there are so many different things. If you think it through, you can find 3 or 4 of them. Easy.
Yeah. Thank you. Thank you very much.
I hope I answered.
What
Yes.
is the
Thank you, Gary. Yeah, I know that we planned for 1 hour, but you took nearly 2 hours. Thanks.
No, we don't have any. You know what? I would do it to any kid, you know. So we have, my kids have counseled so many kids. Even my kids, apart from rotating, even Chetan, Neil, and Sharmania has counseled a lot of kids. The same thing again and again. So
Yeah, so nice of you. Entire family helping the entire community. Thanks to Chetan also for taking time.
Kishore Garu, can I ask one last question?
Sure. Yeah.
Okay. Thanks for Dr. Surya Garu actually for taking this time and trying to help the community. I'm a parent of like a sophomore, raging sophomore. She's in NC State Engineering right now. Like a typical parent, I pushed her into a field that probably she's not interested. She might be doing computers, but she kind of did most of her high school AP courses in biology. So now I realized probably I should let her choose the field. So if she transferred from engineering to the biology, and what if she can't get into a medical school? What are the other career opportunities they can pursue? I mean, rather than just going a doctor. I mean, what are the other things? Is a physician assistant, or there something that you advise, or is it they have to be planned right from the beginning what they wanted to be?
I advise her to do some form of healthcare administration.
Okay.
Healthcare administration is not bad, and actually the tax, not only the taxes, but almost like 30 or 40. I think, if I'm not mistaken, I don't know the exact number. If you become a nurse practitioner, you can have your own practice.
Okay.
If I had a choice, if my daughter would listen to me, instead of medical school, I would have sent an NP school, or try to get into some form of, ophthalmology, or what is that, the optometrist or something, and open up a shop or something. Physical therapist is not a bad idea. Nurse practitioners or physician's assistant is not a bad idea. But if you do the management courses like healthcare administration, and with a small medical degree like a nurse or LVM, if you have those combinations, a lot of them, they become CEOs of the hospitals.
Okay.
There's so many jobs, and they don't need to go slog years and years into this. So, you know what I'm saying?
So does it mean that do they have to do some a 2-year MS after the undergraduation, like if they want to get in? No. Okay.
Healthcare administration is totally different. It's a management course for, especially for healthcare administrators.
Okay. So, but the biology undergraduate,
it's better to have some clinical background, like a RN, registered nurse, and HCA. Then you can apply for a hospital administrator's job. Or there are so many jobs like they need in insurances management and healthcare. There are plenty of jobs, good paying jobs.
Okay. Thank you, sir.
Yeah.
I have to say, Dr. Raghu and Manjula, that you removed some of the mystery out of this process, and you almost peeled the onion for me personally.
Oh, thank you.
You gave some very tangible examples. For example, volunteering in the church with a name. I mean, that makes the point. That really brings the point home what we should be doing. I appreciate it a lot.
No problem.
No, I think the fact of the matter is, I wish we knew what we know now when we put our first kid to college. So it was a process that I learned through the 3 kids. And I think we have to step out of our comfort zone, particularly as Indians. We seem to be very conservative, but I think we need to step out of our box and let the kids expose to the other things in the community, in the society, because they are living in this community, they are learning in this community. They have to be part of this community and learn from it, as well as give back to it. So I think giving back in a different way that you can portray it on your resume makes a lot of difference.
Basically, they are looking how good of a person are you, and what are you going to do good for the society. That's what they're looking on a paper. And if you can put it in 4 different ways, they would love to do it. That's what. Any tips, Peter?
Yeah. Thank you. Thank you once again, Surya Garu, Manjula Garu, Chetan, and have a great weekend.
Much for organizing this.
Okay, Kishore, thank you so much, man. This has been very helpful. Thank you so much. You're a community leader.
Thank you, Ram Garu.
Thanks, Kishore, for doing great job. Continue doing.
Sure, Surya Garu. Thank you.
Always have our
Thank you.
support.
Thank you, everyone.
No problem. Thanks.
Have a good night, guys.